Yes.
Welcome back, everybody. It's you, Rehab, and today we're going to be working on the piriformis muscle. Lots of times people get low back pain due to a short leg, long leg syndrome, where the quadratus lumborum in the low back gets spasms. It usually has a tug of war between it and the hamstring, and they tug of war back and forth between each other. The low back wins, pulls that hip up high, and then so we're going to massage the quadratus lumborum as well as the piriformis, minimus through maximus, glute, and stretch it out. So we can elongate it, and that way both legs are the same length. So low back right here, hip, elbow, you gotta know what you're doing with your hands. Here's the hip bone itself right there. Don't want to be hitting on top of that. So you work right into the glute. That's sore.
It is. The higher you go.
The higher up it, more it bothers you.
Oh, it's making my toes tingle. Yikes.
Is that like a 7?
No. Maybe a 6, 5.
Not too much, not too
No.
low. We're elongating the tissue below the iliac crest. Then we'll go up, and because remember the low back muscles cross the hip and across the spine down into your hip area, your sacrum, and your low back muscles cross down there. Your hip muscles come back up and anchor up top, so into your low back and across the posterior superior iliac crest and spine. So what we're going to do is elongate these tissues here, and then we'll relieve the tissues in the low back, L1 through S1. I go to 3 because the nerves protrude from there, even though there's no movement at that specific joint. There's a muscle tissue around it, so it gets severely aggravated. That word bothers you?
Mm-hmm. Giving myself a crick in my neck.
Don't do that. Yeah, the other one would have gone jung 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 jung. Pick your sound. That too hard?
Mm-mm.
Sore now? Or is it more sore below?
It's more sore where you are now, and then back toward my spine a little bit further. Right there.
Okay.
Oh man.
Burns pretty good.
Mm-hmm.
I know I probably should have shot this from the other side, but there's limited room here, so hopefully you can get the gist. the left leg straight. The upper leg is supposed to be bent more. And like that, and then you have pillows on your head and you're kind of at a 45-degree angle. 40-degree. Too much?
Mm-mm. Getting there. Whoa. That's burning and making my big toe twitch.
You're alive. That's good. It's a good sign. Some people have weird referral patterns, everyone. So, I mean, there's people who can get poked in the hip and they feel it in their scapula. So, we all are built the same but completely different. Too much?
No, it's okay.
You alright?
Mm-hmm. Mm.
You alright?
Yes.
You're really sore now?
It's sore, yes.
But not a bad sore pain. You can feel like the muscle being worked.
Yeah. Yeah, it's been that way for so long, for decades.
Yeah. The longer the injury sits there, the longer it takes to get rid of. You can still always get rid of them. It's just a matter of, I say therapy a minimum of 3 times a week if you really want to get anywhere. These therapists that say once a week, I mean, that's once you're already better in order to maintain the progress the person has achieved. But when you start out by doing once a week, you're not getting anywhere. One day to try and change something, in 6 days for it to regress, it mathematically makes sense. That's what insurance companies are doing these days, as well as the PT clinics. Don't ever let them let you just do once a week when you go in with an injury. Minimum start out is 2, but it should be 3 days a week. Sore tends to bother you too.
Mm-hmm.
That smoke from the fires is making my nose run. We have huge forest fires around here, so the air quality is like almost 305. It's like the top of the scale, so it's not real good at the moment.
I can feel my muscles fighting you.
Mm-hmm. Well, because when an injury's been sitting there for eons, the body doesn't see it as an injury anymore. It sees it as normal. So when you try to change it and make it normal, it thinks that you're trying to injure it, so it fights you. The body is complicated. It's tricky. The way to do it is to trick it.
That's where I I put the thermophore every night, and usually in the early morning again too. On that.
So right here I'm working on the top of the iliac crest, right next to the sacrum. And that junction right there is really hot, very sore, very painful for her. Then we're going to move in working on the quadratus lumborum up to L1, from S1 to L1, and then stretch it out. Make sure the leg is the same length as the other leg, sorry. Lots of times the sacrum gets stuck too, so applying some traction or pressure diagonally across the sacral plate can make a big difference in freeing it up. Joints do get locked. Become very stubborn. Okay, I'm going to straighten the leg here a little bit more. I'm going to keep her on her side, but angle her more towards me a little bit, holding onto the hip. I'm going into the side, the extensor muscles, the group on the directly through the sides, through the oblique. Excuse me, just posterior to the oblique muscle and along your spinalis and semispinalis muscles. I'm taking the broad portion of my hand to massage that. You don't want to just stick your thumbs in there, or index or your middle finger, and trigger point them to death. You need to it's very tender and very pokey. It's tickly and hurty at the same time. So does that feel like you? No.
It's just tender. It doesn't hurt.
Work posteriorly towards the sacrum, along the ridge here, and above on the spinalis and semispinalis muscles to the spine on this right hand side that I'm trying to elongate. Now I'm going to use some pressure with my thumbs. Reduce the spasm in here more. Okay, really sore for you in there?
Right there, yes.
Okay. It's the bottom of the rib, because the quadratus lumborum attaches to the ribs, lower 3 ribs, I believe. Could be wrong. Maybe it's 5, maybe it's 12. I don't know. Brush up on your A and P. Knees. I wish you could see where I'm working here, but it's right alongside the spinalis muscle, the outside ridge there. So if you're lying on the left side, you're going to be able to stick your finger in, and so where the spinalis muscles run out and run into the ribs, you're pushing downward, crosswise, across the spine, into that group of muscles, and working on them that way. And then when you get to the bottom of the ribs, They're usually really hot where they attach. Is that very sore?
Mm-mm.
No. Or now?
No, right there. Yeah.
Right there.
Mm-hmm.
I can feel it. I guess you can too.
Yeah.
Okay, at least you guys will be able to see these stretches anyway. So what I'm doing now is bringing the leg back, getting rid of the pillow. I'm going to scoot her to the back of my table. My table is an hourglass table, so I can bring her right up to my hip. I can hold her onto the table, and there's a space that drops down in between. So bring your left knee up. Nope, your left knee. Your left knee. There you go. I bring it to the back side of the table. Push my hand down into the quadratus lumborum, right there, which then when you, as soon as you push the leg down, you can feel it rise. So take a deep breath, hold it, push up into my hand, outside your leg, good, and relax, let it out. And then massage in there. So you're stretching and massaging the quadratus lumborum, spinalis, semispinalis, hip abductors. I'm going to scoot you a little bit further towards me. There we go.
Oh, ow.
I'm sorry. Again, raise your leg up and take a deep breath. Sorry, deep breath, leg up into my hand, and relax. Not so hard with the leg raising. Just barely, like you're just thinking about leg raising.
Okay.
Okay, I'm trying too hard. Take a deep breath in again, and barely push up. Just barely, that's it, less than that even. Just like you're thinking about it. Okay, and relax. Okay, now we're going to move to face down. Go ahead and we'll shift to face down. Get rid of these pillows. And just here for the final stretch. I cross the outside leg. That's the right side. The inside leg with the outside leg. Cross over at the ankles. There you go. Holding on to the hip. Right hand above and hold the table, please. Right hand above. Because remember, we're stretching this the right side here. I'm bracing here on this side at the right below the waist. I'm now anchoring this spot at the waist of my hand, stretching this way. She's anchoring above and stretching the quadratus lumborum in the low back. Take a deep breath. Hold it. Barely push to the outside of your legs. And relax. And I move her further into the stretch. Deep breath. Hold it. Barely push into my hands. Relax. And she's pushing into my hand going that direction to the right, and I'm resisting it, and then so that elongates the muscle further. So when she lets out her breath and relaxes, it stretches the muscle even further. Deep breath, one more time. Hold it, push with my hands, and relax. And actually, I do it one more time, but I just center when I do this. Don't actually stretch. Take a deep breath, hold it, and relax and let it out. Then I move them into the center position. There is another stretch I'd like to do, just so they can see it. Can you roll over on your back? Is that possible?
Yep.
This is a short, quick one. It's for your right hip as well. And it helps lengthen the leg, the short leg, on that side. Perfect. I'm taking this hip up into flexion, grabbing the base of the hip, SIS or PSIS. Take a deep breath. Hold it. Push your foot towards the ground. Not so hard. And relax. Deep breath in again. Barely push down. And relax. Let out your air. One more time. Deep breath. Hold it. Push it down. You're letting out your air. Don't let your air out when you push. Take a deep breath in again. Deep breath. Hold it. Push. Now let your air out. Relax. There you go. Okay, and the one for the final stretch is to, first of all, I can shake her out here, test the ankle length. And if that hasn't fixed it, we'll go ahead and stretch and then apply traction. Hand at the ankle, behind the knee, just slightly above. Depends on what's comfortable, form or below. Take a deep breath. Hold it. And let out your air. Hurting you at all?
No.
Okay. Deep breath in again. Hold it. And relax. It needs relaxation. Because when you take a deep breath and hold it, you tense up. So in a sense, you're activating those muscles. And then once you breathe out, the muscles relax, and then you can get further distance with your stretch. And one more time. Deep breath. Hold it. And out. And if you notice, I'm doing no jerking movements, just traction, because jerking movements is considered manipulation, and massage therapists can't do that. So perfect. That's what we do for lumbar.